Here is an example of a question that could be resolved by involving a peer. Let's listen into the conversation between these two healthcare students to see how peer coaching could assist.
The shoulder assessment techniques I learned in university are not effective with this patient with an acute rotator cuff tendinitis. I don't understand why they're not working.
During my last preceptorship, I saw a patient with similar symptoms. I decided the tests we learned in university typically apply to patients with more chronic conditions with less acute pain. In this case, the patient's condition is too acute, and performing the test will only aggravate the patient's pain. Once the patient's pain subsides, the patient will be able to tolerate the joint-specific test to provide a more accurate, definitive diagnosis.
But how can I reduce the patient's pain in order to complete the assessment more accurately?
Have you thought about using ice or asking the patient to take their pain medication, then attempting the assessment again?
This has been very helpful. I'll try using ice on the patient, then repeating the assessment if his pain is lessened. If this doesn't work, I will ask my preceptor how I should proceed with this patient's assessment. Thank you.